Welcome to Chat About with Rosalee Henry. Hi everyone, welcome back to Chat About with Rosalee Henry. And today we have a very special guest here with us, Mr. Darren Bazzell. He is a healthcare analyst and an insurance agent with over 20 years of experience supporting families throughout the different transitions of their lives. He's also my business partner and also my husband. So please help me to welcome Mr. Bazzell here with us today.
Thank you for having me.
You are welcome. Today we're going to talk about the Georgia mental health crisis, the things that are going on right now. There's some laws that's passed. But do you think that as an insurance agent, that mental health is treated the same way as physical health?
No, it's not, because health insurance was designed for physical treatment. You can measure physical health, x-rays, blood tests, things of that nature. But when it comes to mental health, it's difficult to quantify that. It's difficult to track it because everybody experiences their mental health issues in different ways.
Now I know why there's so many frustrations that families are going through and struggling, just trying to figure out like, okay, I'm paying all this money for insurance, but if something comes up mentally, I have to be struggling just to be able to see a doctor. So why pay for insurance if we can't use our insurance for the things that we need it for?
Well, a lot of people aren't going to like this answer, but it always goes back to buyer beware. Different insurance companies handle plans differently. It's up to the consumer to actually take time to read what they're getting. Not only that, it's just like anything else. You go to your doctor, you go to a mechanic, anything else. Get a second opinion. There's 1,000 different insurance agents out there. Get someone else to not only offer you what they have, but to look at what you already have to give you a better understanding and to make sure that you got what you were paying for.
Well, thanks for explaining that way. So now we can see it from a different perspective. Are insurance company making it harder for people to navigate what's going on? Or do you think that there should be more education as to how people understand their policy?
That's a two-pronged issue, because even recently there have been reports where not only just regular health insurance, but Medicaid, Medicare, everything is so convoluted and so complicated. And this company is private, this company is public. By the time you get all this information together and you understand what you have, this company may be making money because you're doing it one way. This company may be making money because you're doing it another way. Again, it still goes back to buyer beware. You've got to understand what you have. And you've got to make sure that it covers not only your needs now, but you've got to think into the future.
Yeah. I would definitely say also that it is bigger than one industry. Because if you think about it, I've heard it on the news where insurance companies, they own the pharmacy, they own the health center. They also are the company that the insurer is using. So it's just hard for people to even navigate and know what's the right policy. How do I choose the right policy? Like you said, it is the consumer responsibility to shop around. But if you're working with a corporation and you already have an insurance and you feel like, okay, this is it, I'm okay, but then you're hit with a bill that is outside of what you're even planning for. So how do people even get around that or even know that they should?
Well, in actuality, there's really no easy answer to that question, simply because you have so many different types of coverages. You have the HMO, you have the PPO, you have the independent plans, you have the group plans that you can get at your job. So what you have to understand is not their job to make it easy for you. It is not their job to cover everything that you have. It is your job to determine
As a
one,
consumer.
yeah, it is your job to determine one, if it's going to benefit you in the short term and the long term. And secondly, health insurance was designed only for immediate care or physical care. When you start throwing births, when you start throwing postpartum, when you start throwing mental health,
Mm-hmm.
those are whole different animals that they're trying to incorporate into one thing. And it goes back to, you can't always cover everything with one thing. It needs to be more specialized. There needs to be more research done. And in my personal opinion, insurance companies need to segregate these different coverages
Mm-hmm.
and make them more simplified, because they understand the more complicated and convoluted it is, the more they can get away with.
Yes. So it goes back on the consumer to educate themselves, do their research. Like you said, if someone have a policy, reach out to another broker or another company and compare and see where they are, read their policy, know what their coverage are. So God forbid if something happened, they're not hit with a bill that they didn't think about.
Right. One last thing I will add to that. I'm not saying that you should become an insurance agent.
Mm-hmm.
What I'm saying is, do your basic research, ask around, look for different companies, different agents, and compare. You've got to find what works for you and your family.
What right do people have if they feel like their claim is being denied unfairly?
Um, really not a whole lot. You've got court systems, you've got ways that you can go in and try to get the system to help you. But by the time you jump through all the hoops, by the time you get through all the red tape, you are so frustrated, so tired, so financially drained. A lot of people just can't get the process completed. So they just give up.
On that note, we're going to take a short break and we'll see you back in a few minutes. This is Chat About with Rosalee Henry.
Life is a circle. It isn't always perfect, but it is powerful, moving through moments that test us and transform us. Our one focus is to honor every part of that circle, from routine care to rare condition. This is the one place where compassion and innovation move in balance. Within this circle, we see the first breakthrough that bends fear toward hope. The first moment that says the end is the beginning. Each first creates echoes, second chances at what's next. Love regained, tomorrow reclaimed. At Emory Healthcare, we are driven by firsts, inspired by second chances, and determined to advance humanity through science, all to keep life's circle moving forward.
One more?
Welcome to Chat About with Rosalee Henry. Welcome back to Chat About with Rosalee Henry, and we have here with us Mr. Darren Bazzell. So, Mr. Bazzell, we want to talk about the hidden mental health crisis, because as us being in this field, the caregiving field, being a caregiver ourselves, but also supporting caregivers, do you think insurance companies are doing enough to help with caregiver burnout? Is there enough attention
Short
to
answer, no. And I say no simply because it, insurance companies aren't designed to deal with the caregiver. They're designed to deal with the person that they're taking care of.
So wellness is not even part of it.
No,
No.
you're, and this might be an unpopular opinion, but you are a caregiver. You are a person who is expected to go in, deal with someone else's physical and or mental issues, and no one is looking at the fact that that caregiver has their own problems that they have to deal with after work. It's just like a person in a corporate environment. When you go to work 9 to 5, you go to work 9 to 5. Everything outside of that company is not the company's concern. And right now, I don't think that insurance companies are doing enough to help not only the caregiver, but also the person that needs care. Because as we said previously, the coverages and the policies are so convoluted, so difficult to navigate sometimes, that people just take whatever's put in front of them.
Yes.
And if there is a problem, by the time they go through arbitration and having someone look at this,
The
possibly go to
frustration.
court, the cost
Yes.
outlay on top of everything else that they've been paying,
Yeah.
it's not worth
They're
it.
not worth it. Right now, 1 in every 4 person who is in the workforce is caring for someone after they get off work. So you're talking about someone who's working a 9 to 5, but when they get off that job, they still have a job to take care of their family members. Sometimes it's a child, sometimes your spouse, sometimes it's your elderly parents,
Or a
and
combination
a
thereof.
combination are off. And if you think about if this person have to take time off from work any extended period of time, a lot of times they do not have insurance during that time. So now it becomes a crisis, because now they have to think outside of what they have with their job. They might have to go on public assistance. A lot of time it is not available for them. So then that becomes another issue. Do you have to choose with caring for your family member or staying at work and be burnt out and still have no one to care for your family members?
That is a situation that is faced by several families, especially here in America.
Yep.
And I don't see insurance companies dealing with that because technically it is outside of their purview.
Right.
What you're going to have to get, or people are going to have to get their legislatures
Yes.
involved.
Yes.
Is going to take government changes, not only to put more pressure on insurance companies to give better coverage, to make the coverage simplified so that people can better understand it, but they're going to have to enact laws and policies to make it better for working class people.
Yes.
Because as you state, you got a 9 to 5, you got to go home and take care of somebody, you got to get up the next morning and do this all over again. Yes, people can deal with it, but it does start to affect you not only mentally, but physically.
Yes. And this is when it becomes a public health crisis. Because if you are working a 9 to 5 and still have to go home and care for someone else, you're more likely sleep deprived, you're overwhelmed. It's going to be lack of production at work. So now your boss is going to be looking at you sideways because you're not able to pull your weight. So now your job is in jeopardy. And this is how the trickle effect and increase in public, becoming public crisis.
Yeah, but that's not the insurance company's problem.
I do agree with.
They're there to help if you have an actual medical crisis. As far as you organizing your life or putting things into perspective or understanding your situation, that is not their concern. Their concern is, okay, we've got this in place, use it or don't.
Right. But I can see where it would be more cost effective to the insurance company if they put things in place like wellness, right? I know you laugh because you're with the insurance company, so you know that that's not what they think about. They're thinking about their bottom line, their profit. But if they make sure that the people who need the support, right? They provide the wellness. They're making sure that people have the outlet. They're going to live longer. They're going to be able to be more productive at work. So even the employers, if they provide this type of service for their workers, they're going to have a better output. So stop looking at the short-term profit and looking at the long-term goals, because we're living longer. We need the aging population is going to need more people to help. So if everybody is going crazy because they can't take care of themselves and their sanity and be burnt out, nobody's going to be available to take care of the aging population. So then it's going to go right back to the public crisis. But then again, why do you think people wait until they're overwhelmed before they seek help?
Two things. First, to answer the first part of your statement about insurance companies, profit margins and things of that nature, you've got to remember, it's more profitable to deal with a sick person, give them the medication that they need on an ongoing, constant basis, than it is to have that same person go out and find some type of alternative or natural cure.
Right.
So that is cutting into their profit margin.
Yes.
I'll answer the second part of that.
You're, and to your point, you're perfectly right about that, and that's why I brought up earlier what I'm seeing going on, where the insurance company they own the pharmacy, they own the health center. You know, they're the ones who are the policy holders. So, like you said, if they keep those people on the medication, they have shares in the pharmaceutical company, so they're getting paid so many different ways. So I do see where you're coming from. I see it every day. So on that note, we are going to wrap up, and we will be back for our next segment. Thank you so much for watching.
After a successful inpatient procedure, a prominent star from TLC's 1,000-pound best friends begins her journey to recovery with personalized care from Mothers Helping Hands Home Care. Trusted and recommended by her doctor, we're here to ensure a smooth and comfortable transition home. Featured prominently on TLC, Mothers Helping Hands Home Care is your trusted partner for professional care.
New Orleans don't make a lick of sense to most people. A big city built below sea level that throws logic out the window and beads to strangers. And our chicken is no different. A fast food restaurant selling fried chicken that takes 12 hours to marinate? That makes no sense. But it does make delicious. The best recipe for big flavor ain't about logic. Because you know magic when you see it or when you taste it. We don't make sense. We make chicken.
Love that chicken from Popeyes.
Thank you for watching Chat About with Rosalee Henry. Hi everyone, welcome back to Chat About. So Mr. Bazzell, if you could snap your finger, what is one insurance change that you would make based on everything that you see going on right now?
As far as health insurance is concerned, the one change I would make is I would make it so that people, no matter what or where they are, they can choose their coverage. And part two of that, I would also include holistic care, because I found that there are natural solutions to several everyday problems.
That doesn't cost a lot.
It doesn't cost a lot of money, but insurances will not cover it. So a lot of people would opt for the pharmaceutical remedy instead of a more natural remedy, simply because there's no out-of-pocket cost. And no matter how low cost the natural remedy is, people still have a budget that they have to stay within.
I would add to one of the things that I would change is eliminating prior authorization for mental health. People shouldn't have to go through the ringer. And I know you're insurance agent, but that is one thing that I wish that I could see change, among others, which would be prolonging postpartum support for mothers. That's
Touching on the
another
mental
thing.
health thing, though, you have to understand that just like anything else, that can be and is being abused. People claiming to have mental issues to get out of certain things. So you do still need to have some prerequisites. You do still need to have some checks and balances. But I think from a personal standpoint, there needs to be more coverage as far as that is concerned and more options for people to have, especially nowadays with cell phones and being able to do the telehealth style
Right, that's true.
sessions.
Yeah. But still, we have to understand that there's still so much stigma behind mental health that a lot of time people don't even want to talk about it. Sometimes even at work, there may be services available at work, but people are so concerned about, oh, if I let my boss know that I'm feeling this way, then my career's on the line. There's so much things that they have to put in consideration. So, and sometimes it's not every organization, like you and I, we make sure that we have a culture where our workers can come to us, or HR, and express how they feel, but not everyone have that opportunity or even feel that they can go to HR and talk about
That is
mental health.
true, and that is a culture change that needs to happen in corporate America, but I don't know if that's ever going to take place. From a insurance standpoint, nothing we can do about that simply because that is the culture of the business. The business runs the way the business runs. The only thing that I can say on that regard is that people need to remember you are an individual person. You have your own issues that you've got to deal with, and you have to determine, is it worth your mental stability? Is it worth your physical well-being also? Because you got to remember, when you have mental issues, that can also start affecting you physically,
Yes.
depending on how your body reacts to stress and other factors.
Yes.
You have to be able to get the help that you need, and that may require that you do some things outside of the company and set aside that time to get that help.
Yes. So, what role do you think employers play in making sure that their employees are taken care of?
From a purely corporate standpoint, none. Not their job, not their concern. As long as the work's getting done, that's the corporate environment.
Yeah.
Now, if you want to take it from a purely personal business area, like with what we do,
Right.
it is, in my opinion, and I'm going to keep saying that, in my personal opinion, it is more beneficial to make sure that your workers have an outlet for mental care as well as physical care. Because if that person understands, feels, recognizes, and acknowledges the fact that their boss or bosses are concerned about them, they in turn will be more concerned about the business.
Yes.
It's not always
investment.
it's not always about the worker's dedication to the job. In my opinion, I think the job should show some dedication to the worker to get them to put out more, to feel more, and to do more.
Yeah, I agree with that. If you were advising a Georgia lawmaker, a legislator right now, what major reform would you want to see happening, like right now?
Right now, one of the reforms I would have would be, well, there's several, but one of them would be cost. It doesn't cost as much as is being made to show in health insurance. Plus, I would have them do more as far as alternative medicine. Again, pharmaceutical companies are getting over big time.
Yes.
There are medications out there where one pill costs $10,000 a
Yes.
month. And I know that they have to recoup
Yeah.
research money, but you can't tell me that if you've got 1,000 people taking this drug, you can't reduce that cost to make it better for them.
That's true.
So from an insurance standpoint, yes, they can push more natural health related remedies and also find cures, not just stabilizing drugs. Actually cure the issue so we can move on to something better.
For me, I would say education, pushing education, making sure that this is something taught in school, mental health. The same way we have physical education, we need to have mental education from K through 12. So when we get this into the younger as possible age group to where they can understand it, then when something happens, they can recognize burnt out, they can recognize anxiety, they can recognize depression, and they know who to go to. So on that note, Mr. Bazzell, thank you so much for this wonderful conversation. I know we have many more follow-up on this, but if this is something that resonates with you, please share with someone, follow us, like, comment, because we want to bring this more and more, the awareness more, so people can understand what is going on, how to advocate for yourself. So again, this is Rosalee with Chat About, and until next time, take care, reach out to us. We're here for you. We want to support you. Contact us. So it's Rosalee Henry. And also our website is mothershelpinghandsatlanta.com. Check out my YouTube page. We love you and we want to keep supporting and bringing this information to you.
Have a good day.
Thank you for watching Chat About with Rosalee Henry.